Hello, and welcome to the Invisible Threat Protecting IoT and Medical Devices. I'm Jeanette Wider, Managing Editor of Healthcare Innovation, and today I'm here with Todd Burcham, Solution Architect, CyberMDX. I'll let you take it from here, Todd.
Perfect. Thank you, Jeanette. So as she mentioned, excited to talk to you guys today about protecting IoT and medical devices. So we'll go ahead and get started here. So real quick, a little bit about CyberMDX. We were founded in 2017. Our mission is protecting medical devices. We want to protect the things that protect and save human lives. And, we're very passionate about that. We have grown over the years. We have many good clients in the US, Europe, and also Asia. So we're global. We're based out of New York City. There's lots of different reports and everything out there from things like Forrester and Gartner that you can read about us. But again, we're very passionate about it, and we really enjoy what we do. And we know that in life, for all of us, we've either we've been patients before or we're going to be patients, but this is something that touches home to all of us. And one of the things that also on here that we're very, proud of, from our solution standpoint is something that we call DeviceCentric risk management, or DCRM. Because as we look at all these things and we know what a challenge it is, we really created this to try to help get work done and actually protect the devices. So this is something that gives you actionable items to protect your devices. So we'll talk more about that here in just a little bit. So the agenda I want to cover today, first off, is the current state, where we sit as far as healthcare and cybersecurity. What are we seeing out there? Go over the special risk challenges that come in with medical devices. And then we'll look at some of the best practices to help, assess these and mitigate these risks. Because, just hearing about all the bad stuff isn't good. We want to give you, good items and ways to protect them. And then I'll mention at the end about a customer we have in the Southwest region and, California that has been a great use case for the system and really helping to protect these devices. So we'll go ahead and get started here. The first thing, where are we at today? What are we seeing out there? So unfortunately, we are seeing that the healthcare is this perfect storm for when it comes to cybersecurity and attacks. We've seen a large increase of attacks on healthcare providers, especially since the COVID pandemic hit. Healthcare is on the forefront of everyone's minds, and a lot of additional patients. Unfortunately, it's become a bigger target. We've seen a jump of over 500% of attacks on hospitals since that. Ransomware up 71, and that is by far, we've seen the worst thing out there that is bringing hospitals down completely. They have to shut down all their systems and cease operations in some areas, and it's really crippling. The phishing attacks, those are up quite a bit, unfortunately, because they work. That so many people fall for the phishing attacks, and a phishing attack can lead to, some lost data or, lead into the ransomware attack. That's one of the ways that ransomware gets on the network is through the phishing. So you combine that with the fact that every day more and more devices, medical devices are being added to the network. Years ago, especially looking at networking, we had servers, workstations, and printers. And that was it. That's all we had to worry about. Well, now everything is coming on the network, including medical devices. And this is all for good reasons. It's making these devices more intelligent, giving them more functionality, more manageability. But of course, when you get it on the network, now it's actually, it's a concern because it can be, attacked. So a lot of good comes with it, but then of course there is the risk factor. And not just medical, but IoT in general, there is just an insane amount of devices being added. When we look at, HVAC systems, camera systems, phone systems, clocks, everything, appliances, vending machines, everything is coming on the network. It's making it easier for vendors to manage and maintain. It's bringing all this functionality. I can, set my thermostat from anywhere. I can, turn on the coffee maker. I can turn on the stove. I can do all these things. It's so great. But every new device we add into the network brings in more potential ways that attackers could get, into the system and compromise. So while all these good things are happening, we're constantly just adding more and more, weaknesses to our systems. And when we talk about cybersecurity in the past, everyone's mindset was, that's an IT problem. That's for the CISO and everyone in the technology. I'm not worried about that. That's not my department. But it really is an issue for everyone. And when we break that down, first off, you look at patient safety. When you're talking about vulnerabilities where we can compromise medical devices such as anesthesia machines or infusion pumps, the results can be catastrophic. We've done demonstrations in the past showing where we can take control and send commands to an infusion pump, change the infusion rate, and you can only imagine what effects that could have on a patient. So it's very important from patient safety. Then we look at the threat to data security. When you're talking about privacy and, healthcare information and social security numbers, once that's been exposed and compromised, you can't just buy your way out of it like ransomware, or you can't, if your credit card gets compromised, you cancel it, you change the number, you start fresh, and the damage is stopped. With healthcare information, there's no way to really stop the potential damage from that exposure. Then the last piece, even in a nonprofit situation, all hospitals have to function as a business. They can't be losing money. They won't be able to keep the doors open. And obviously the last thing we want is for the hospitals not to be open. They have to be able to function financially. And especially when we see with like ransomware, when these attacks occur, they're completely crippling the system, causing, hospitals not to be able to do their job. And even when they have some cases where they have cyber insurance, so they can, be reimbursed financially, we're seeing that getting harder and harder to obtain because these attacks are happening so often. So big thing here is that cybersecurity is now for all of us to worry about, not just the IT department. We take a look here. This is some data that we've put together from our systems that we have out there around the world. So some, analytics of everything. And it kind of goes right along with what I talked about before. There's more and more medical devices being added. So, seeing new medical devices on average, 60 new devices a month appearing on the network. So whether that's, replacement with newer technology, the more and more stuff though is hitting the network. And with that, every time we add new devices have vulnerabilities, right? They're weaknesses, things that they could be compromised on. So the more devices you add, the more vulnerabilities you add, and things that we need to think about protecting to prevent those from ever happening or being exploited. And a lot of the times too, we see this in so many devices, is the mentality of it's not broken, so don't fix it. So a lot of devices that are out there, they're running outdated software, which are more and more susceptible to being compromised. It's a double-edged sword, right? Because if you stay up on your patches and you're constantly doing software updates, you run the risk of having bugs or new things that came along with that patch. But if you don't patch it, then you really run the risk of being compromised and negligent in that part. So it's a tough area. We also see a lot of the new devices that, out of the box have vulnerabilities. So it's something to be considered when you're onboarding new devices. I kind of mentioned earlier too, about IoT and the fact that, the building systems, all these different things now are on the network. And, I think about even like at my home and stuff, it's crazy when I start adding up all the different stuff that's on, the network, from, light switches to appliances and everything. And this happens everywhere, and not just in homes, but in businesses too. Again, getting all that great control and management and features, but it comes with a risk factor. And those are growing substantially, every single month. And we've seen the ransomware attacks. We keep reading about them more and more. They're happening. You see it in the news. These hospitals are getting compromised. Their systems are shutting down. They're either having to go through and restore their systems, or in some cases, they're paying the ransom, which 90% of the time does not work out good in the long run. But a lot of people feel that that's their only option. But there's been tons of, exposure of PHI, in facilities affected by this. So unfortunately, it's a moving target. It's great in so many ways that we're adding all this stuff, but every time we add new devices, we add more vulnerabilities that we need to worry about. So when we look at this, and this is kind of a complex, messy image here, because this is illustrating what I just talked about. There's so many devices out there, and there's so many pieces to it. So most organizations all have, a guest network, right? And network teams do a really good job of segmenting that. So it's really not a huge risk. But the problem that we've seen is that, you have your guest network that has patients' devices, their family, employees' personal devices. Well, sometimes we've seen where employees, they're working with a device such as a wireless infusion pump, and it's not working. So they start pressing buttons, and then next thing you know, they've got it connected to the guest network. So these are types of things that, become a concern, that, we need to alert on that type of information. But so the guest network comes into play. You look at the hospital campus, you could really break up the devices on there in two big categories. One being managed devices, so things that are controlled by, a centralized system such as like Active Directory or an endpoint protection or mobile device management. Those are the good things that we can track, OS versions and make sure that they're patched and centrally control that. But unfortunately, there's a whole lot of devices, and especially medical devices, that are what we call unmanaged, that get left behind. There's a really good chance that the maintenance department isn't updating the HVAC software or the IP clocks and all these other systems that don't have centralized management, and medical devices fall into there heavily. They just get left behind. So that's there on the hospital campus, which extends out to the clinics. Again, more and more devices. Many hospital organizations have dozens, if not hundreds, of remote facilities. We look at the third-party connections. So, without naming names, we all know of different organizations that were compromised in the past, different retail and things like that. And when all the information comes out, they're like, well, how did they get in? It's like, well, they actually dialed in through the remote maintenance for the HVAC system, and then they got full access to our network. So ever-growing concern of third-party connections. We've seen it grow, I don't know how much of a percentage-wise, but remote workers, while they were common before and kind of a minor piece of the puzzle for security, that since the last 2 years with COVID-19, that has just gone 100 times bigger. So many people are working remote now, and this adds a whole nother level to security complexity. And in some cases, unmanaged, personal devices getting connected. So it was once a small piece of the puzzle. Now it's a huge piece of the puzzle. We talk about cloud, it's been a buzzword for years now. In some ways, it's fortunate for hospitals that it hasn't been adopted as quickly as it has in the private sectors. But anytime you introduce another piece of the network, you add more security risk. And when it comes to the cloud, a lot of times the end customers don't have a whole lot of control over that. And you have to take, you have to trust in your provider that they're doing what they say they're supposed to be doing to protect your data. But when we look at the healthcare security suite, these are the four big pieces to the puzzle, as far as managing all of this. So the first piece being asset inventory and tracking. You have to know what you have in order to protect it. So that's a very critical piece. Then we look at, okay, we know what we have, what type of risk and vulnerabilities are there, and what type of actions can we take to minimize that risk. Governance and compliance. So this is things like, are we following our own rules? Are we running outdated software versions? Are we using insecure protocols? Are we breaking the rules? And then detection and response. We put all the security measures in place and we hope everything is going well. Well, we need to know if an incident occurs. We need to know if a machine starts communicating with, command control for ransomware. We need to know that, hey, this machine just started communicating with a forbidden country, and then have a response plan in place to take when those events occur. Of course, we talk about all these different devices. Unfortunately, medical falls into its own world of, it's even harder because it typically communicates in insecure protocols. So most of the data is not encrypted as it goes across the wire. A lot of these devices run out there for years and years and fall under that, it's not broken, don't fix it. So they're not getting these patches and, vulnerability fixes. And a lot of times we can't put endpoint protection on them. There's so many rules that we have to follow with vendors that they become it's a whole nother challenging world when it comes to medical devices. So, we talked about all these scary things and, how big the network is and how it's growing every day and all these new vulnerabilities. Well, how do we start managing that and mitigating some of these risks? So as I mentioned before, step one is you have to know what you have. Without, a live accurate inventory. And when I say live, it's changing, every minute. There's new devices connected or devices that fall off the network. So it is something you can't just take a picture, it's like, oh yeah, well, we do an asset inventory check, January of every year. Well, that's not very useful. It's something that has to be running real time in order to be able to properly protect it. So part of that is, of course, classifying all these devices, figuring out what they are, what version of software they're on, is it managed, is it unmanaged? So accurate inventory, step one. Then once you have that inventory, we know there's things that can be done to help protect these. And it really falls under a few different categories here. There's configuration changes. So, there could be vulnerabilities with certain protocols or, remote desktop that we could disable if it's not needed. So sometimes it's configuration changes on the devices itself. Sometimes there's software patches that can be done. So, there's an update for maybe a Windows OS or whatever it may be. Endpoint protection. Obviously, this is huge. We hopefully we all run it. This is the way we try to stop, viruses and malware from, coming from our machines. Unfortunately, medical, not always an option. And then, of course, segmentation. And, it's been a big buzzword in the last year, microsegmentation. And really, it's not an overly complex concept. When we first started doing networking, and I've been doing it for many years, we were so excited that we could connect devices and let everything talk to everything. And isn't this beautiful? We made it, this network where everyone can talk. Well, the reality is there's a lot of devices that don't need to talk to each other. There is no reason that the time clocks, down at facilities needs to talk to a medical device. So there's a lot of areas where we really need to segment stuff down and say, you know what, these are the places you need to go, and that's it. In order to protect you from the outside world, we're only going to let you go where you need to go. So segmentation is huge. But when you combine all this together, you still always have to keep in mind, there's no such thing as, 100% security. You have to do what you can do and do your absolute best effort, but always knowing that there is still, a risk factor. There's still vulnerabilities out there that we're unaware of today. It's just impossible to ever say that you're 100% secure. So the next thing here, when we look at device-centric risk management, the DCRM component of CyberMDX, I talked earlier about this. We're very proud of this. And once you identify all of your assets, you have this giant asset inventory, maybe tens of thousands of devices. We've identified all these different vulnerabilities. You have to know where to start. It's very overwhelming. There is, when you give a task list that's so big, and like I said, you look at it and you just get blurry-eyed because you're like, I don't even know where to start with this. There's too much to do. So DCRM is all about helping you prioritize those devices. Where is the best place that you should start? What is the most critical assets? And then once we identify those, let's look at things like in a 3-tier approach. One of them is, what can we do on the device? Is there any configuration changes or patching, or can we do antivirus on the actual device? So that's the first layer. What can we do on the device? And then the second layer is, what can we do at the network level? So this is on the internal network. This is a place where we traditionally never secured anything. If you were inside, you were good. If you were outside, not so much. But there's a lot of things that we can do to help protect these devices right at the network level. So maybe there's specific allow lists that we could put in place, or we can put in a block list of things that we know are bad. So that's at the network level of protection. And then the final layer is that traditional external access control. Do these devices really need to talk to the internet? How is the vendor managing them? Anything that we can do to protect them, by eliminating that communication channel to the internet, then we want to do that at the perimeter level. So you're really looking at, this 3-tier approach of what can I do on the device, what can I do on the network, and what can I do at my perimeter. I talked about, helping prioritize all this information, and to kind of just show you a little bit of how that's done. If you look at the chart here, if you have devices and you have vulnerabilities, and there's many factors that go into this decision, but this is a perfect example here. When you look at, a risk, first thing on the left-hand side, you look at the likelihood, like how likely is it for this vulnerability to actually, be exploited? Some vulnerabilities, when you read them, will say that the attacker needs physical access to the device. Well, if this is an X-ray machine that's kept behind, in a closed room with a lock and key, honestly, the likelihood is probably pretty rare that an attacker is going to get physical access to it. So it's going to really lower the priority level of, hey, you should go fix this vulnerability or patch it, because the likelihood's not there. Same thing with how significant is it? If I was to compromise this device, what kind of impact could I have on the entire hospital? Could I, take down everything? Could I only affect this one device, or could I infect multiple devices? So this is just kind of an example of those factors that you have to look at as, to help prioritize, again, because man hours are hard to come by and it's a lot of work to do this. So you really want to look at all these different factors so that you're getting the most bang for your buck when you go to start patching things and mitigating your risk. A perfect example of that, here there's a vulnerability, it's called Ripple 20. It actually was affected multiple different device types. Well, here you can see it affected an infusion pump, but it also affected a printer. Now, when you look at it from a CVSS score perspective, yeah, they're both a 10, which is the worst rating possible. But you factor in things like, patient safety, impact to the business, a risk of EPHI exposure. The score is astronomically higher. You need to prioritize the infusion pump over the printer. So again, prioritizing is crucial when you have so many tasks at hand. And this is just a perfect example. Same vulnerability, but I'm not going to personally want you to waste your time on the printer first. Eventually, yes, we would like to get to that and fix that, but the infusion pump is much more important, and we need to prioritize that. This whole process, of course, vulnerabilities are things that can be, weaknesses. When those are attacked, you've got to have a system in place to be able to notify your SOC team, your security team, and let them actually respond to those incidents, whether it be, removing them from the network or, re-imaging a machine. But the whole goal here is just make sure you have a plan in place and you have multiple layers of security. This attack detection isn't just coming from appliances like ours. It has to come from multiple layers of security. If you're going into battle, I want the armored vehicle and I want the body armor. I want everything I can get to where I can still do my job and be safe, but I'm not going to rely on one piece of security. So you're going to have multiple feeds coming in to help with that detection and response. Last thing that I wanted to cover here real quick is that we did have a case, a good case study with a customer that was in California. It was a large county. They had this enormous network, all these different departments. They had no idea about all the different devices that were on the network and what their security posture was. So the CISO really ran with this and said, you know what, we're going to make this a security focused initiative, put the solution in place, started identifying every asset on the network. Once we knew what was on the network, we could identify the vulnerabilities, and then they were able to break that out by department. Okay, at the hospital, biomed, you're in charge of these assets, go start mitigating those risks. Facilities, you're in charge of all these IoT devices, go start mitigating those risks. So it's really been a great success story, and it's a tough battle. It's a long journey, but it's something that we all need to do, and this has just been a great solution for that. So I greatly appreciate your time. I really hope this was useful and some good information. And again, thank you again.
Thank you so much, Todd. That was a really informative presentation. And thanks to our audience for joining us today. And this concludes today's presentation.